Welcome to the Strong as Fuck podcast. I'm your host, Kenny Santucci, and join us for some strong conversations. All right, we're back with another podcast, and today's guest is, like every other guest, very special. Obviously, I like having my friends on here who I feel very comfortable with, who have something to share with not only me, but you guys as well. My guest today, we have a lot of friends in common and also some enemies in common, but she's very knowledgeable, and I'll have her give you guys a little bit of her background on what she does, but I'm very excited to get her on here. And for all of you guys out there who are wondering why I look so great on social media, ladies and gentlemen, the reason why, Dr. K. Dr. K, thank you so much for being here.
Thank you, Kenny. That is the nicest introduction you've ever given me.
So there's a lot of quacks on social media talking about hormones and supplements and steroids and everything else under the sun. It's becoming a lot more user-friendly. It's a lot more socially accepted. We met about 2 years ago, and kind of give everybody a little background on what you've, your education background, and then on, how we met.
Absolutely. So I am a conventionally trained doctor. So I'm an MD. I finished a second program in integrative medicine from the University of Arizona. So I'm a little less conventional than all the typical New York City doctors.
Why is that?
Because I believe in medicine should be individualized and you don't need a pill for everything. Okay. Sometimes you do, sometimes you don't. A little bit about what I do. I do hormones. I do standard medicine. We do peptides. We do optimization. We do a lot, right?
And there's
everything.
And this is becoming, I remember when talking about hormones and hormone therapy was like taboo. It's looked down upon. And now in the last, what would you say, 2 to 3 years, it's become more acceptable?
Yeah, I think there's a lot more light on the benefits, short-term and long-term, on hormone therapy. And when I talk about hormone therapy, I talk about bioidentical, clean hormones. Yeah. Hormones that look like the hormones that are in your body.
So what's the difference between that and necessarily the negative?
Bioidentical hormones look exactly like what's in your body. So from a molecular standpoint, your body has no idea that it's getting it from a shot as opposed to making it itself. Okay. Everything else synthetic, made in a lab, doesn't look like your body, doesn't quite fit, which is where you kind of come up with all of these laundry list of side effects.
So the difference between getting your supplements or your hormone therapy from a doctor rather than some drugstore in Tijuana.
A lot of differences. But, there's so much online, and you said it. Yeah. You can put yourself in 500 different things. Are they beneficial for you? Maybe, maybe not. Yeah. But you really should only be on what your body needs, and less is more. Yeah. And nothing is forever. Supplements get to be changed out. And everyone has different lifestyles, different sustainabilities, different goals, which warrants different protocols. What
made you want to study this? And for me, it's like I'm starting to notice, and this is just my observation from being in the space that I'm in recently, or in the last 15 years, 20 years, is a lot of what goes on, because people are always, and I'm one of these people who's like, well, you're fat because you're lazy and you don't want to do the work and blah, blah, blah. And the more I start to understand it, the more I start to realize that, well, your nervous system and your endocrine system are just as inherently flawed or better for some people rather than others as everything else. So your looks, your skin, whatever it may be. So a lot of those things are kind of the roll of the dice with a lot of people, correct?
To an extent. Your genetics are not your destiny. Mm-hmm. You have a lot of predispositions. We all have predispositions, and there are some that we know about and there are some that we don't know about. Mm-hmm. But if the base of your life, if your endocrine system's off, if you're not well balanced, similar to how if you're not eating right, you're not sleeping right, you're not drinking enough water, if your base is not there, then you can't outwork it. You can't out-inject it. You can't out-supplement the basis.
Yeah.
But it's not the end all.
Yeah. So why do you think it was looked down upon for so long when people used hormone therapy? Like, let's just say we all acknowledge the fact, and there's some people, a lot of these talking heads on social media talking about, well, guys necessarily don't have to lose testosterone as they get older, but we all understood that to be true after a certain age, you start to lose it. Women, start to lose estrogen as they get older. Why was it looked down upon to use those supplements for so long?
So easier to answer for women. There was a big study that has been revoked and kind of the results have been taken back, and however you want to call it. But once that study went out, it kind of scared a lot of physicians, and scare is a very good tactic.
And what year is this? Like what?
Early 2000s.
Okay.
So once information gets out there that something could potentially be dangerous, despite how many times it has been revoked, it's very hard to take that imprint out. For men, I'd say a lot of the studies weren't, kind of shuffled into testosterone therapy or hormones or well-being because there's no money in it, right? Yeah. So it's like no one really looked at it. The studies that they did look at sometimes were not really controlled. It was a bunch of meatheads who were doing X, Y, and Z who were getting their steroids from who knows what and ended up with all these different things. Yeah. So I think that it's kind of finally became apparent that, hey, as we age, our hormones decrease. That is definitive, right? Can you make some lifestyle changes to off-put that? Yes. Is it inevitable? Basically, yes. So in my opinion, the difference between a 50-year-old male and a 30-year-old and how you feel, and we can talk about how you feel when your testosterone's low versus high, but that difference is testosterone. Yeah. That's what starts to decrease, and it makes a massive change in how you act, how you sleep, how you move, what you eat, your libido, everything. Yeah.
Well, and for the longest time, and my understanding of steroids as a kid was the Incredible Hulk effect, right? You take steroids and you start breaking shit and beating people up. Since I've been on TRT, I feel way better and I treat people way better. And when I came off it for those 2 weeks a year ago, I was uncontrollably an asshole. I was like, why Miserable. Do I feel? Yeah. So could you give people a little insight as to like why that happens and like what's going on?
When someone is on testosterone therapy, and I'm talking controlled, not bringing you to crazy levels, just kind of back to normal, back to where you should be.
Yeah, and give us a range. Like, so, 'cause there's a lot of people out there who are like, oh, you should be at 1,1300. I'm like, that's crazy. My doctor wouldn't let me get to that point if I asked her to.
No. So all the labs are different, right? So there are standard intervals and they're all ranges. But I won't give you a number because there's no number that you have to strive for. Okay. It's based off of you. It's based off of how you're feeling. It's based off of a few other factors, and it's individualized. Hormones are always individualized. And if, I don't know what your hormones were 15 years ago, but I know that you're doing well now. I know what your numbers are now, and I know when you feel good. That's what you strive for. You strive for feeling good, not I want to see 1,200 on the paper. I want to see greater than 1,500. Yeah. That's not the goal. Yeah. The goal is to feel good. And
I tell people the same thing with exercise. Everybody's like, well, I should be doing back squats and deadlifts. I'm like, well, if they feel like shit, then we need to find another version of a back squat or a deadlift that you should be doing. So back to when we met a couple of years ago, because I know there's a lot of people out there that we both know who insist I'm taking a bunch of shit, which is great. Thank you guys. Because I think I look like shit still, but everybody else thinks I look great.
Body dysmorphia, Ken.
Yeah, that's what it's called. I've had it since I was younger. But everybody's like, oh, well, you could take this, this, and this. And I came to you because I had gotten a blood test from a couple other doctors. And they were like, you need to go get a CAT scan. I go, why the fuck do I need a CAT scan? And they're like, we think there's something wrong with your pituitary gland. So give everybody kind of the back end or the medical side of like what had happened and what I can and can't use.
Correct. So what you have is a pituitary adenoma, which is a really fancy name for a growth on the pituitary gland. Pituitary gland's in the brain. It sits right behind the eyes. And it's responsible for spitting out a bunch of different hormones that tell your body to make other hormones, right? Everything is a feedback loop. So your brain says, I want more hormones, spits out from the pituitary, and then your body makes hormones. Based off of where this growth is in your particular pituitary, you weren't getting any signal to make testosterone.
Yeah. And how's that happen?
There are a lot of different kind of theories, but there's not
like
really
cancer.
one size.
It
Yeah,
could grow
there's
from
not
it.
really like a you did this and that's why you got it. So you were bottomed out. Your levels were lower than mine are right now, to be honest. It was not a good scene. But so you have been on testosterone, nothing, very, very high, just to bring you to where you should be.
Yeah.
You also had a little bit of an issue with making thyroid hormone. So that also contributes, but it's all along the same axis.
Yeah.
It stems from that growth blocking the pituitary. So in your case, and it's very specific, and these are not super uncommon. So there's, I don't know how many, a lot of people walking around with them unknowingly. You don't want to take anything that could potentially stimulate the pituitary that tells your body, hey, I'm going to go to the pituitary gland and make more, because there's not enough data on any of these supplements, peptides, anything that says it won't actually make that grow bigger. And you don't want it to get bigger because the surgery to get rid of it is horrific.
Yeah. Well, the other doctor who originally did it for me was telling me that if it did grow, that I could go blind from it.
Yeah. I mean, you would be very symptomatic before that happens. You'd
Yeah.
have horrible headaches and your vision would be blurry. But yeah, you don't want it any bigger. And the surgery is horrible. They go through your nose, they cut it out. It's a 4-month recovery.
So for me, HGH, peptides, all that's off the table.
And peptides that stimulate the pituitary to make more growth hormone, off the table. Because I can't promise that growth hormone would not make those cells grow, also off the table.
So with the peptides, and everybody, I've been noticing this, and Christy's always like, do you think this girl's ass is real? Do you think she works out? And I go, Chris, I'm telling you, this girl takes, she's on something. It's been wildly used by men and women
Oh, absolutely.
in the last couple of years.
Longer than that.
So what are the peptides that are most common? Because, I'm familiar with them now because you hear Huberman talking about them and everybody.
Yeah.
Like the CJC, the BP 157, it's we're hearing about these same ones. And what's going on with the government now with the FDA kind of banning these? So where did it come from? Why is it so widely used now? And then where's it going? Because they're kind of stopping it.
Yeah, no kidding. So the peptides you hear of are a very small subset. There's dozens, right?
Yeah.
They're just small proteins. Proteins are really long amino acids. Peptides are really short. So it's, semantics. Tiny proteins, they tell your body to do different things. There are a lot that are used in athletic performance, recovery, optimization. Those are what you're talking about. BPC, ipamorelin, CJC, in oral, injectable, whatever the case may be. There are also, though, peptides for your gut, for digestive issues. There are peptides for anxiety. There are peptides that are for ADHD, that overseas they use them first line in kids because they don't believe in throwing, amphetamines at kids at 6 years old. Go figure.
So do you
There's dozens of them.
Yeah. So do you think the peptides are better than, most of these pharmaceutical drugs that they're pumping into every little kid,
I'm not a believer in a lot of the pharmaceutical drugs. I think that some of them are very, very good, but there's side effects to everything, and the pharmaceuticals are pharmaceuticals.
Yeah.
You can take a peptide, which is essentially a protein, very short half-life, very clean. We know all the pharmacies that are making them. I way more prefer that.
Yeah.
Absolutely.
And now what's going on with the FDA? Obviously we know anything involving the government, they just want to get a cash handout. Why out of nowhere did they kind of shut all this down?
Yeah, so that's a good question. Essentially what happened was the FDA came out, and peptides are not illegal. They are still not illegal. And they said to
But you can't
compounding
just go
pharmacies,
buy them somewhere. You have to get them from.
they have to be prescribed.
Yeah.
Most of them. Some of the oral ones, like BPC oral, which is mostly for the gut, not really for muscles and soft tissues. A lot of people sell that as a supplement.
Yeah.
But essentially, they do have to be prescribed, and it's by compounding pharmacies, meaning the pharmacy makes them.
Yeah.
It's not like CVS or Walgreens.
Well, because I've had a couple people give me bottles and be like, here, take this BP 157. And I sent it to you and you're like, oh, it's more for your gut than the shot. What's the actual difference in makeup between the shot and the...
So BPC is something found in your gut. It's in your intestinal lining, your gut juices, right? And its role when taken orally is to patch up kind of the inside of the gut, the lining of the stomach. So it works very, very well orally. A lot of the peptides can't be taken orally because they get broken down. But because this is derived from the gut, it's very, very stable. When you take it injectable, it's more for acute soft tissue injury. So either preoperative optimization, post-op, a surgery, an acute injury, a pulled muscle, a torn muscle, a ligament, that's when you inject it. But the actual makeup is the same. It just works differently in different formulations.
And now with everybody, and so what's the government going to do now?
Back to that. Yeah. So they essentially came out and it's not illegal. It's not illegal to use peptides and it's not illegal to prescribe peptides. They just made it very hard to compound. And what they did was they made a list of 12-ish, top 12 most popular, left out all the rest, did not include semaglutide and tirzepatide, which are better known as Ozempic and Mounjaro. Because if those were included, a lot of money probably would have been lost. Those are off the list, but they made a list of it's very, very hard to compound those and make them now. So a lot of the pharmacies are working through what they had at that time, but not making any more.
So all these people who are getting benefits from all these peptides, they're not going to be able to get it anymore.
No, not from those peptides.
So what's the resolution for that?
It's a good question. Certainly not pharmaceuticals.
Yeah.
It's not going to be replaced with a pharmaceutical drug, but it's a shame. It's a disservice to a lot of people because you have people who are getting healthier and feeling better, and it's proven time and time again, the safety and the efficacy, and now it's taken away for what? No one, the FDA approves a lot of things that are in our foods and are banned for human consumption in other countries, even other states. So it's wild to me that something that's helping so many people is now going to be very hard to find.
Well, you mentioned Ozempic and Mounjaro. What's the real difference between the two of those?
Ozempic is semaglutide. Mounjaro is tirzepatide. Essentially, semaglutide works one way. Tirzepatide works the exact same way as that, but has an additional property. So it's the same medication, but Mounjaro has like a special second effect.
Okay. So I have sure. So I have a client who's on Mounjaro, and he would chew his nails and had all this anxious energy, and he's still kind of off a little bit, but he doesn't chew his nails as much. He's much more reserved. He's still fucking annoying sometimes, and I'll tell him that. But what is it in that drug that kind of makes you calm down a little bit, like that you don't have this anxious feeling?
So, and it's the same for Ozempic to an extent. And there's been recent articles that came out, and I refuse to click those articles. I refuse the clickbait, but I've seen the titles. And essentially what they're saying is, this is the new anti-addiction drug.
Yeah.
Fine. Really, it's an anti-cravings drug. So if you crave alcohol, or you crave carbs, or you crave biting your nails, whatever you crave, synonymous with an addiction, right?
Yeah, like what part of your brain is that it's kind of turning off?
So it changes the chemistry in the brain, and it basically turns it off. So you can sit there in front of, your favorite food or a plate of cheesecake or whatever the case may be and say, you know what? I'm full. I don't need any more. As opposed to, I need more and more and more. Yeah. Similar with drinking coffee. People cut back coffee. Similar with alcohol. Can you do it? Can you work through the drug? Yeah, you can drink through the drug. You can bite your nails through the drug. But it takes away the noise. And it takes away kind of the craving. Which
I find fascinating. I feel like it's a miracle drug because it does do that, but it doesn't have a long shelf life. Really, right? Like how long does that last? Like how long could people, because a lot of people are like, should I take it? Should I do it? And some people shit on me because I'm like, hey, listen, there are people, I suffered with it. When I was fat, I would eat like a slob. I remember the first time my father wanted to kill me because he came home from ShopRite. He had all this meat and I just ate everything. And there was no off switch when I was fat. Yeah. I remember I got kicked out of a 5th grade birthday party because there was 4 pizzas and I ate one of them myself. And the parents were real pissed about it. So it still haunts me because every parent.
I can tell. This is really something that
right? Could you imagine remembering something when you were 12 years old? And they were all yelling at me. They're like, you ate a whole pizza. You couldn't have it all for yourself. And I'm like, oh man, I am a fat fucking slob. So, what is it?
No, it's tremendously important. There is, as a society, we have a very poor relationship with food. And that is a societal issue. And it's been for decades. I don't know how long it spans. But, when you take out the emotional connection with food, when you cut it, it makes it, and you put yourself in power to be able to choose how much you eat and what you eat. It's very empowering, right? So as far as shelf life and what you mean by that, I think is how long you should be on it or when it kind of weans off.
Isn't it like every other drug? Addictive drugs. I'm talking meth, heroin, shit like that. Where
certainly not meth and heroin.
Well, no, but
on the record saying that.
Saying it becomes like everything. Cocaine.
Yeah.
Right? You start doing it, and then you need more to get that same rush.
Yeah.
Right? Like, isn't that how it works essentially?
Yeah, like tolerance.
Yeah.
You mean tolerance,
yeah, your
right?
tolerance.
So the drug is meant to be taken more and more. Even, Ozempic, it's in different milligrams and you kind of need more and more. Mm-hmm. But the way to use it is not, I'm going to take it so I don't eat this. It's to use it as a tool.
Yeah.
To say, actually, I can have one cookie and not need the whole box. I can go to dinner. I can just eat the dinner that I'm provided and I don't need dessert. And if I need dessert, maybe I just have half or maybe I have one. So it's a tool and it's about reconstructing the relationship with food and habits. If you can cut out snacking at night for, I don't know how long, officially 7 weeks they say to break a habit, whatever the case may be. But if you can break that habit and you're using this as a tool, that is where it's most beneficial.
And this is where I become so pro that drug is like, there are people that I've worked with, clients of mine, friends of mine, people I know everywhere. And they've tried everything, but they just can't kick that little voice in their head out of their mind saying, oh, hey, you need this, you should have more of that, blah, 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 whatever it may be. But they're seeing success with this drug. And if you could use that window of time to get rid of that habit, then that's what it's basically, it's a catalyst for you to now live a better life.
Right, it's a tool and it should be used as a tool, but it's not.
Yeah.
So this is where a lot of the backlash comes. If you use it to inject yourself and not eat, that's not the goal, right? Mm-hmm. When you come off of it, you're going to put the weight back on. If you use it to inject and eat like an asshole and realize, hey, I can start having a Starbucks muffin every day, I'm not going to gain weight. When you stop that medication, it's plowing back on. Mm-hmm. If you use it to whatever these kind of the abuse is here, if it's not used with proper education or support, it's going to be a disaster after. And then you're going to feel worse because you're going to put on twice as much weight. And a total disaster.
And that's what I think people are missing is, there's so many people who are always looking, they're like, oh, I found an easy way. It's like, no, it's not an easy way. It's like, it's a stepping stone for you to go to the next level. But if just like you said, if you're going to start eating like an asshole again, then you're just going to put that weight back on.
Correct. And it's, it's kind of like, it's a tool.
Yeah.
And there's a lot of abuse and there's a lot of people writing it, but it's just a tool. And you can't out-inject a bad diet. You can't out-inject not working out. There's things you need to do. Yeah. Also, if you're not eating, you're just injecting to not eat, you're going to lose muscle and you're going to look like a smaller, softer version of yourself, which is gross.
Which is terrible. Yeah.
Like horrible.
I know a guy here in the city who's been on and off it for 2 years and he feels like a bowl of pudding. Like he's so fucking soft and he's like, well, I'll need to lift because I take Ozempic. And I'm like, yeah, but dude, you're so soft. And what's that doing to his bone density?
But that's the opposite mentality. You should have to lift because you're on Ozempic.
Yeah.
You have to preserve your muscle. You are looking to lose fat. I don't like weight loss. That's not a term I use. I use fat loss because nobody wants to just be a smaller version of themselves. You want to lose fat, but you have to lift on it. You have to preserve your muscle. You can't just lose everything.
What are 3 things that, because obviously you're prescribing this to people. What are 3 things you tell them they have to do?
Non-negotiables.
Yeah.
Non-negotiables are eat and definitively eat enough protein.
Yeah.
Lift. And if lifting is the worst thing they could ever think of in the world, some form of movement, but almost always, I'm a big advocate for lifting. Yep. And drinking enough water.
So there's a lot of talk right now on the having this Olympics. I forget, it's the guy who started PayPal or something?
Yeah.
Who wants
Performance Enhancing Olympics?
Yeah, and they're kind of being a little, and it's becoming more and more lenient. And listen, I'm an advocate for, I grew up in the Arnold Schwarzenegger, Sylvester Stallone rock, and I was very disappointed when I got to about 16, 17 years old where I realized that, all these guys aren't just doing workouts, they're all using drugs. And so everyone I've ever admired as a child, aside from my father, was on steroids. And now it's becoming wildly acceptable for more and more people to do it. It's like you look at, the top bodybuilders and the top, The Rock, all these guys, even the people you don't even think are on it, are doing something. Yeah. But they're becoming more lenient, and as well they should, because now you have, you could fucking shoot heroin in the street and they'll give you clean needles. You might as well let people take steroids and play sports. But what do you think the side effects of this are going to be? Are you going to see new drug development? Are you going to see people just using the same stuff? What do you think the outcome of a lot of this is going to be?
That's interesting. New development for sure. There's going to be money in it. It's a whole new market.
Yeah.
What they will develop, and by they, I don't know, supplements, pharmacies, I have no idea. There will be new development. But I think overall, people should do whatever they want with their body, right? Like you want to inject your body with steroids, by all means. Yeah. I can talk till I'm blue in the face of maybe why you shouldn't, or maybe why we should discuss a different option, but you should do what you want. So I think opening it up to saying, hey, if we're already all taking these, why don't we just come clean? And now we're all on the same level.
Yeah, yeah.
Like, fine. Yeah. But I don't know what will come of it. I hope, I don't know, more acceptance.
I spent a good amount of time in the CrossFit world. You're a big fan. You're getting ready for the Open and everything.
Sure am.
And people always ask me, they're like, how many of these guys and girls do you think are using shit? I'm like, I would say most of them, if not all of them, only because of the performance aspect, right? Like to compete multiple days in a row at a very high level is very hard. It's almost like asking a football player to be like, all right, you're going to compete on Sunday, Monday, and Tuesday in a row.
Yeah, impossible.
It would be impossible, With that, do you think there are people who aren't necessarily using stuff in like pro sports? Because Chrissy's obsessed with some guy who plays football. Yeah.
Travis Kelce.
Yeah. So I was saying, I go, this guy's definitely taking something. Probably not during the season, but he's on something because he's 260 pounds of fucking pure muscle. I'm like, it's pretty hard to get to that point. Anybody who's been in and around the health and wellness space or, knows anything is like, well, you don't get that big and pack on that much muscle.
Chicken and rice.
Yeah. And everybody's trying to sell you on this. But I work out a lot. And I'm like, yeah, all right, my ass, you work out a lot. Like everybody's doing the same amount of workouts, right? You go to the same CrossFit gym, everybody's doing the same workout, but there's one guy in the corner who just looks like
3 times the size
of everyone else.
Veins are everywhere.
There's one in your gym actually, and we both know him.
Yeah, that's
and he has all the symptoms: missing hair, fucking bigger shoulders than everybody else. we will leave you nameless. You know who you are.
We love you.
But with that being said, like, with the acceptance of a lot of this stuff, do you see a lot of people in your gym asking you like, oh, hey, could I get this? Could I get that? I mean, are you?
Yes and no.
Are you the dealer in the gym?
I'm a dealer for a lot of people. I think people should do what they want. And if I can help you perform better and feel better about yourself and recover and make your workouts more worthwhile and get out what you should be getting out of course.
And everybody thinks that we have some sort of back end deal where you're like paying me. That's why I recommend you to everybody. I wish that were true, but there are people who are like, well, do you think she's giving me this because she wants to make money? I'm like, listen, as somebody who's been our client for 2 years, I've asked her for shit and she won't give it to me.
Correct.
So, and I'm willing to pay for it. And you're unwilling to pay for it. Right. And I don't think she's pushing these drugs on you. There's so many people who have this like thought that like, oh, doctors want to give me this shit. Right. Now, I'm sure there are doctors out there who could make a ton of money off giving, but like, because I'm sure people have said this to you before, like, oh, are you trying to give me more? Like, what's your response to these people who think you're trying to dope them up?
Funny enough, my response to anything, injectable, supplement, recommendation on drinking more water is do what you want. Yeah. These are my recommendations. Yeah. You don't have to follow it. Yeah. It's your body. I'm not going to tell you what to do. This is how to optimize or get to where you want to be. Yeah. You want nothing? We do nothing.
And this is what, when we first started working together, and that's why I told all my friends, my family, I'm like, you should work with her. Because I went to 2 different doctors who, actually 3, 3 different doctors who I went to and I'm like, hey, listen, I have this problem. My back was killing me. I was in a miserable space.
Yeah, you were an asshole.
My testosterone was low. I felt terrible.
Yeah.
And every one of them's like, yeah, well, I could give you a cream, maybe a shot, go see, sign the paper and sent me to the fucking girl at the front desk. And I'm like, what the fuck was that? Like, are you going to explain anything to me? So what I really appreciated about what you did was you were like, all right, here's your results. This is what you need. This is what you should do. This is what you shouldn't do, but it's your choice. And I really appreciate that. And there are very few doctors out there. So if you're listening to this and you go to somebody who's not like thoroughly sitting down and kind of, here's everything, here's all your options, you kind of make your own. Like, that's what I really appreciate it. And it's the same thing with a good trainer or a good real estate agent, whoever you're dealing with, like, here's all your options. I'm going to do the best job I possibly can as your guide here. And you kind of choose what you want. So do you think that's your technique because you give a fuck, or you're like, that's the right thing to do? Like, what is it for you?
Both.
Yeah.
And medicine's individualized. Yeah. We're not the same. We don't live the same life. We don't have the same families. We don't have the same job. We shouldn't be recommended, blanket recommendations. It should truly be individualized, right? How you eat, how you sleep, how you train, past medical history, family history, what your labs show to an extent. That and what's going to be sustainable for someone is what should tailor your outcome. It's not, hey, this lab was a little high, take this medication, come back in 6 months.
Yeah.
Bullshit. So it's the only way I would practice medicine. The only way. I left the hospital system for a reason. Yeah. But that's just my opinion.
What were some major flaws that you have seen? Because I hate to shit on all doctors, but I've had some really shitty experiences with doctors. When I have back pain, go see this doctor. He's the #1 surgeon in New York for back pain. Go see this guy. He's the #1.
Yeah, they all operate on the Jets and the Giants.
Yeah. California, New Jersey, New York, Florida. I went to go see different doctors in different states. Every doctor was like, we could cut your back open and fuse your spine. And I'm like, I'm not going to fucking have my
Probably
back.
not.
And I'm sure there are hundreds of millions of people out there dealing with some level of back pain. And then the numbers are staggering because when I was looking into it, and a lot of people get this recommendation. I have a very good friend who lives down in Florida now who got the back surgery. And I'm like, are you a fucking idiot? I can't believe you. He's like, no, I feel all right. I can't do this, 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 and this, but I feel fine. I'm like, yeah, but you can't fucking move. Yeah. So like I've fallen out of trust with a lot of the medical field because I'd rather pay for a doctor who's, I'd rather pay out of pocket than pay the insurance company because insurance is another fucking broke, screwed up system. That like, okay, I'm paying a premium, but I'm getting somebody who actually gives a shit rather than somebody who's just like, oh, I could buy a fucking new car if I just operate on this guy's back. The one surgery that I did have, and I told you about this when I tore my shoulder, it's the one surgery that I was like, all right, I'll go get it. And I wound up worse after the surgery than before the surgery. After the surgery, I'm missing my anterior delt and part of my pec. Before the surgery, I was just missing part of my pec. So now I'm missing 2 things out of the surgery. What the fuck is going on in the medical field?
I think we have enough time for that. But you know what? It's not through any fault of the physicians. I don't think that physicians are malicious.
Just the system's broke?
The system is destroyed.
Yeah.
Right? So first off, insurance companies, they play into a lot of decision-making, which is bogus. And then medicine has become so subspecialized that no one took the time to think, hey, maybe your back problem isn't just a mechanical issue, which you didn't have.
Yeah.
Maybe there's something else going on. The whole body's connected. And that's where we've lost medicine because it's so subspecialty that a GI, a doctor for your stomach, won't talk to you about your heart, won't talk to you about anxiety. They'll say, I'll go to a psychiatrist. A heart doctor is not going to talk to you about, maybe they'll talk to you about diet. They're not going to talk to you, about a pain in your leg. It's just, it's so subspecialized that you get ping-ponged without anyone just looking at the whole picture and saying, hey, maybe there's another reason.
Yeah. No, I definitely think, well, I know now that it was a hormonal issue.
Right.
And, and I read the John Sarno book about, the nervous system and back pain and all this stuff. But it was, in my opinion, it was more of a chemical issue.
Correct.
And, if you could kind of dive into like what was going on or what was happening in my body that I was having all this back pain, and how many other people, and I only bring it up because how many other people are like suffering from some level of back pain that they're like, well, it has to be a structural issue. I'm like, it might not necessarily be a structural issue because, and I tell people this all the time. I go, when I tore my pec, it's like, it was black and blue. It was clearly damaged.
Right.
So that
was an acute injury.
Yeah. And that's a structural, something structurally is broken.
Right.
When the endocrine system's broken, what is going on?
So it's not always so sudden. It's not an acute, oh my God, I just benched too much and I destroyed myself, right? It's sometimes a slow trickle. So it's very hard to pick up on. It can, oh my goodness, the side effects of an endocrine disruption can lead from metabolic, weight gain, weight loss, mood, anxiety, heart palpitations, joint pain. In your case, it was back. The list goes on, but ultimately it comes down to listening to the patient, taking a good, thorough chat. It's not always labs. Labs will tell you definitively, very black and white, but listen to the patient.
But it's fucking crazy to me because you guys go to school for so long. And they're, and I've heard this from multiple physical therapists and chiropractors, like they only teach you how to treat the pain, or they only teach you that one aspect of it. It's not like you're not looking at the body as a whole. Correct. It's just like, all right, here's the pain problem, just fix that.
It's algorithm based, which is not correct. And if something doesn't fit in a perfect algorithm, like back pain, okay, rule out that it's not this, this, and this.
Yeah.
There's no, oh, well, maybe it could be something else.
Why isn't this more like...
There's no time, right? Yeah. So you have to remember, when you and I first met, we spent over an hour together.
Yeah.
You go to a conventional doctor, they can't spend an hour. Insurance is paying them. You're a healthy guy. Insurance is going to pay them less than minimum wage for an hour. They can't sit with you for an hour. I can sit with you and very quickly figure out, put the picture together because I have the time.
Yeah.
So that's a huge portion.
Yeah. I just was on a podcast for bodybuilding.com and we were talking about the same thing. Like people will invest in the dumbest shit. You'll buy a fucking fancy car, a nice couch, a fucking $3,000, $4,000 or $5,000 rug, whatever the fuck you're buying.
Thousands of dollars in sneakers.
On stupid shit. But like when it comes to paying a doctor, like the amount of people I've sent to you and they're like, oh, dude, it's expensive. I go, it's your fucking health, you idiot. Right. Like I sent you to her for a reason.
Right.
And it's the same thing with like training. It's like, I'm going to teach you and take you through all the things that you haven't done for yourself. Well, I could go on an app and just find a workout and do that. I go, but you're 35 and you haven't done it up to this point.
Correct.
What the fuck makes you think you're going to do it now?
Right.
So when it comes to investing in your health, it's mind-boggling to me that so many more people aren't like, oh shit, well, what's my life worth? Right? Let's say it's $12,000. $12,000 a year isn't that much to take care of yourself.
Right. Especially when you don't take care of yourself for X amount of years, you're going to be paying way more in chronic disease. Yeah. Right.
And well, if I would have got that back surgery, even with my insurance, it would have been fucking 80, 90 grand.
It would have been a lot. It would have been a lot. And you'd be still in pain. It was not getting
and I'd be in a worse
It was not
place.
getting to the root of the issue.
Yeah.
Maybe a Band-Aid for a little bit. But, it's just, I say it all the time. The time is going to pass regardless, right? You can pass the time in your life preventing chronic disease, or you can kind of negate that aspect and the time will pass and you'll end up with chronic disease.
Yeah. Well, and that's what annoyed me because it's like, here I am going to see these physicians. And I said to the one doctor, this little old man, he was skinny old little guy. And he's like, he's the best back doctor in the world and blah, blah. I'm like, he might be the best back doctor in the world, but he's not like a general physician. He's not looking at me as a whole. And I said to him, I go, you don't think that I could fix this issue through any other way? Like, working on different movement patterns and stuff like, because I obviously like I know Stuart McGill and all these guys who talk about like fixing people's back pain. I'm like, you're going to tell me that the only way for you to fix my back, this little old man who's never probably picked up a fucking weight in his life is telling me there's no way exercise is going to fix this. You're going to degenerate and be worse. And I'm like, all right, let's just say I was what, 38, 39? Mm-hmm. I'm 41 now. I felt better in the last 2 years than I have in the last 6 years before that. So I'm like, even if taking TRT and feeling, why wouldn't I do it?
Right.
It would make no sense why I wouldn't take something that helps me feel better on a daily basis. Then I would have probably blown my fucking brains out if, no bullshit, if I had to go get a back surgery, lay in bed for 6 months, like the level of depression that I would have probably gotten to would have been probably to the point I'd want to kill myself. When I tore my shoulder, I was in bed for 2-3 weeks, or I was supposed to be in bed for 2-3 weeks. I got on a bike. I was, bike, and the doctor's like, "Be careful, don't do anything. You might tear it." And I'm like, "How the fuck am I going to tear my shoulder again sitting on a bicycle?" Right. So I was doing a ton of like flywheel and soul cycle and shit at the time. But so many people, like I think there's a lot of doctors out there who have to look at it the same way you look at it. It's like, all right, well, let's take this holistic approach. Right. Let's rule out all these other things before we say, all right, you need to go get surgery. But yeah, it's crazy to me how everything's kind of shaken down. But anyway, I'm glad. I think, are we out of time? Do we still have some time?
You got like 5.
Okay.
So like if you just want to wrap up.
Yeah. Well, I mean, what's next for Dr. K?
What's next for Dr. K? Yeah. What's next for Kenny Santucci?
I got nothing.
Another pair of tight gray sweatpants? Is that in the mix?
I mean, people have been asking for them.
No,
it's been wildly accepted, especially even Canada. I just got back from that Canada trip, and everybody's like, "Oh, nice gray sweatpants." I'm like, "Thank you." I was like,
my signature look.
Yeah, yeah. No, I appreciate you coming on. Thank you so much.
Thank you for having me.
You've been a huge help. Guys, if you're looking for access to Dr. K, just slide in her DMs like a lot of guys do. All right. No, but I appreciate all your help. Where could everybody find you? What's the...
Oh, Evolve Science.
Evolve Science.
Practices Evolve Science.
Evolve Science. That's what it is.
DMs, come on.
Think of it. Evolve Sciences. You guys are unbelievable. They have a great practice there. I send literally everyone there.
Literally everyone. From
my mother to my best friends to just random people I meet on the street. And, we have a lot of happy customers. But again, it's not just like everybody always thinks it's like, oh, you're pushing something. I'm like, I'm not pushing anything. It's just like optimize your health. The first thing I have most of my clients do, you obviously know this, but the first thing I have people do, I'm like, go get your blood work done. Because if you don't know what the fuck's going on in your body, then you can't really make any other good decisions.
Right. And if there's deficiencies or you're all in balance, you can't out-train that. Yeah. So you know, just like you can't out-diet it, you have to be balanced.
And I mean, there are so many people that I don't want to name, but one of our clients who was, I have back pain, I have hip pain, I have this pain, I have that pain. I'm like, dude, it just seems like pain's ping-ponging around your body. I don't think it's like there's nothing wrong with your fucking knee. You could squat. Right. So if there was something wrong with your knee. So yeah, I mean, there are so many people that you have helped out. So thank you very much for that. Thank you for helping me.
My pleasure.
Yeah. And everybody else. So guys, join us on another episode of We Don't Know What the Podcast is Called Yet with Kenny Santucci. But I appreciate you coming by. I appreciate you guys watching. We'll see you next week.